Today we're going to talk about drugs. Unfortunately, this is a topic that comes up more often than not. This video is going to help you identify drugs and figure out how to be safe. If you work in the community or you have kids, this video is for you. We all know if we don't educate our kids, somebody else will. Let's take a look. So first thing you want to do if you suspect you're going to be handling a drug or you know you have a drug, always wear your gloves. One thing you want to see is burnt foil. This is usually a sign of drug use or drug paraphernalia. You'll see the burnt marks in the foil. Drug users use a lot of simple items to smoke the drug through, simple as straws. We call them glass tutors. You can use pipes and stuff. A lot of that you'll get the black residue, or there'll be residue of the drug still in the pipe. So again, when you handle this stuff, you want to make sure you have your gloves on. The first drug we're going to talk about is methamphetamine, or crystal meth. It has many street names, but for today's purposes, we're just going to call it meth. It looks and feels like a crystal, hence the name. This drug is a stimulant. It's very addictive, and it will cause your body to speed up and will give you an increased feeling of energy. Users are more likely to be alert, and they can go days without sleeping. This is a common drug we see that causes paranoia in its users, and some of the common side effects would include insomnia, erratic behavior, sores on your skin, or tooth decay. It is possible to recover from methamphetamine with a strong rehabilitation program. Okay, the second drug we're going to cover is cocaine. Similar to meth, this is a short-acting stimulant. What's different about it is the high you're going to get is only going to last 30 to 45 minutes versus with meth it would be a much longer high. Cocaine is also more expensive than meth, so we see a lot of users choose to use meth over cocaine because it lasts longer and it's cheaper. One thing about cocaine is that it produces dopamine. Dopamine is a pleasurable neurochemical and will make users want to use it again. For this reason, it's highly addictive. It is possible to recover from cocaine, but you would need an intensive rehabilitation program as well. The third drug I'm going to show you is heroin. Unlike the meth or the cocaine that I've showed you, heroin is an opioid and it's actually a depressant. And the symptoms is extreme drowsiness, kind of a clouded mental state. It also decreases your heart rate and your breathing. And it can be recognized, it's a sticky tar-like substance in appearance, has a strong vinegar smell. To be honest, we don't see heroin on the streets like we used to, since it's expensive for a daily user. And the next drug I'm going to show you is 50 times stronger and much cheaper than heroin. So you can recover from heroin, but it's a tough road and only a small percentage of people have actually been able to recover from it. This last drug is the important one, guys. This is fentanyl. Usually comes in a little blue pill form. However, you can also get it in a powder. We also have seen different colored pills, but typically the blue pills is the popular one that we find in Pierce County. What you need to know about fentanyl is this is much cheaper than heroin. It is an opioid, a depressant, and it causes the decreased heart rate, the decreased breathing, and after that initial high, it's extreme drowsiness. This only costs about $2 on the street currently right now, so it's very easily accessible to everybody. Lastly, too, with the fentanyl, after it causes this significant drowsiness, many users will just fall asleep wherever they're sitting at the time they take a hit. And you can overdose with any substance, but fentanyl is the one that we're experiencing the highest amount of overdoses with in Pierce County right now. I hope you found this video useful and educational, especially if you work in the community or you have kids. Be mindful of what I showed you today so that you can recognize the dangers of these drugs. Remember, if you don't educate your kids, somebody else will.